When the COVID-19 pandemic caused schools to close, many parents had to stay home to care for their children. This left many hospital workers with a dilemma. They needed to stay home with their children, but hospitals, already short-staffed, even before the pandemic, needed them at work to care for patients. Here is how St. Joseph's Candler solved both problems.
Well, what we were experiencing in the early days of COVID was turning how we operate essentially upside down and in a very short period of time. We had to become completely preoccupied with keeping the caregivers and everyone who worked here safe because we were now an infectious disease hospital.
First hearing of the COVID pandemic and knowing that schools would be closed, your first thought is, what am I going to do about work? You know, who's going to keep the kids? I've got to be able to work to provide for the family. So hearing of programs that would be available to help with my kids so that I could go to my job, not be worried and stressed, so that I can be here doing what I need to do, providing care for people in the community to be able to move forward with procedures and all that they needed to have done.
The disruption that they had started at home with their families. They're human beings just like everybody else. And they're not in a type of profession where they could work at home because what we do in a hospital requires you touching someone. So what's in the back of their mind is trying to balance that responsibility with everything going on in their family life and trying not to get distracted by that. We had a cabinet of advisors. So the topic was, with the school systems closing down, is that going to have an effect on staffing? And the answer was clearly yes. Someone was going to have to stay home and plug in everyone to this new world of e-learning. That's when the light bulb went on and said, we're going to get into the elementary school business. What we had to do was get portals that were geographically dispersed because our coworkers lived all over. And that's where the idea came up, YMCAs. Why don't we call them up and see if we can rent them? And that's what we ended up doing.
Can't describe the relief that came with that. Thinking, okay, I don't have to be worried. The YMCA is a great organization. I know that they'll have competent staff that'll look after my kids. And through the hospital, just having that sense of security and the fact of feeling like your employer was definitely there having your back to help you get through this time and not having to stress so much about, what am I going to do now?
So the social accountability part of it is economics. If someone had to stay home and do schoolwork with the child, it would default in most cases to the mom. So that was very important to us as a collateral reason to make sure we could take care of the home life so the mom, who ended up with most of the responsibility, wouldn't end up being taken out of the workforce and then have to play catch up when this COVID is all over.
I feel like having the e-learning camp available to me is a great help. It allows me to come to my job, obviously my normal schedule, and if I needed to pick up extra shifts to help out because of other parents having difficult times or something happening, I'm available to do that. Both of my girls really enjoy the camp. They do their Zoom meetings and their programs on the computer, but they also get free time to play. The teachers at the e-camp do create fun games and activities for them to do. I'm just greatly thankful and appreciative for all of the thought and consideration that's been put into helping the staff here. Having someone to help you with not only providing the service, but then helping with the actual cost of the service is just amazing.
What would I like to say to this team? I couldn't be prouder of anybody more than how I am proud of them. In fact, I couldn't be, frankly, more humbled on what an honor it is to work here and kind of seeing them in action. I have seen caregivers hold hands. I've seen caregivers hug patients. I've seen caregivers cry with patients. And then at the end of life, I've seen them go into a supply room and break down themselves. So I think that they've really have chosen the right ministry. I think that they're in a healthcare ministry. And I think what they've done is, love thy neighbor as thyself. And I think that's what it's all about.